Hi, everybody. We're here with Jo, and she has been a vet nurse for, I think, about 28 years. And she's here to share the importance of oral and dental hygiene in pets. So I'm going to hand it over to her now. And Jo, please, introduce yourself and, tell the people what they're gonna expect during this live session.
Okay, hi. Thank you very much for the introduction, Andrea. Thank you very much to Dogspot for inviting me here. So my name's Jo, and I work on behalf of Swedencare Prodem Plaque Off. It's quite a unique product that we'll come to at the very end. It's not about selling, it's just letting you know that it's there, and we're also going to look at the reasons why oral health and hygiene is important in our pets, and that sometimes that we just forget, or we think it's just a dog or just a cat, and then we're going to look around that and start off with a bit of basic anatomy. So thank you to Andrea. I've been in practice a long time, seen lots of different things, lots of different cases. It's all been very interesting, so hopefully you'll find this evening interesting as well. I have got with me a little fox's skull that's been loaned to me, which shows obviously the canine teeth, the nares cavity. So we're just going to start off by having a look. But so if I say, what is oral hygiene to you? What is it? What does it mean to you as a person? How often do you brush your own teeth? Hopefully twice a day is everybody's telling me.
I try to.
I try to. No, you do. So how often? And you might also use mouth washes and things like that, dental floss, chewing gum, alongside twice a day brushing. So why treat your pet any differently? So I think there's a slide that sort of asks those questions.
Cool. So should we just get onto the slide? So
yeah, that's cool. Thank you.
Okay. All right. So as the slide says, and Jo, you can take it from here.
Yeah, that's fine. So why we're brushing our own teeth? Their makeup is exactly the same as ours anatomically. As it says on the slide, in the UK, 85% of cats and dogs over the age of 3 shows problems caused by plaque known as periodontal disease. On this image, it's a dog's canine, and you can see just above on the gum mucosa, it's quite ulcerated. So where it's red above, that's where all the tartar, and it's very, very hard, rough surface has been rubbing on the gum. So the dog's got an ulcer as well. And ulcers, as we know, are very painful and very sore, and we don't often, have them for very long before we start, complaining about them ourselves. So it's about, statistically 85% over 3. That's massive. That's an awful lot of pets that have oral problems, and we'll talk about different ones that can attribute to that as well, and obviously talk about prevention as being better than cure at the end.
Cool. So I mean, if our viewers can see, can you see this little my cursor going over this little red bit? That's what Jo is talking about. How it's been rubbing against the plaque that's formed on the teeth, and it's formed that ulcer. So this is something to show you guys that how important it is to maintain oral hygiene. So we have Jo with us to, just give us her expert opinion on that. So we're going to go ahead to the next slide, if that's okay with you, Jo?
Yeah, that's fine. No problem.
Okay. So okay.
Yeah, no, I was going to say, this is a perfect example of, so everything sort of has posh names in veterinary science. And so the milk teeth that we refer to as milk teeth are called deciduous teeth. And when they're persistent, so the diffidont term just means that they will have milk and then permanent teeth. But as the image shows, quite often, if you have a patient presented for neutering or castration at about 6 months of age, and they're still showing these very small baby teeth, they need to be removed. In relation to breeds, it's common in a lot of the smaller dogs, the terriers, the chihuahuas, and French bulldogs, pugs, those dogs with a squashed face where, it's hard to put all of those into the mouth. These will normally come out at castration. So if they haven't gone by 6 months, they need to be removed because it'll cause a malalignment of the the permanent teeth that are coming through. So this is a permanent canine, and if the small deciduous one was there, it would just be just in front, and that can cause problems with the bottom jaw, etc. So it's important to check, and also to have these fiddly milk teeth removed if they remain.
Cool. So do you think, so what you're trying to say is that it actually repositions the teeth and
yes.
affects the bite and the chew ability of the dog, right?
Exactly. So when it comes to the bottom jaw, you might find that top tooth is then going into gum rather than so you're absolutely right. It will cause a lot of problems and be very uncomfortable.
Okay, so you would recommend that if a puppy over 6 months of age still has their milk teeth like this double tooth over here, we should get it shown to a vet and get it removed, right?
That's correct. Yes, definitely. Yeah.
Okay, awesome. That's good information. Yeah. Okay, so we're going to move on to the next slide.
Yeah.
And let's explain to our viewers what a tooth is all about.
Okay, so their makeup of teeth is exactly the same as ours. There is no difference whatsoever. So as the image says, the outer part is the enamel, and that the top part of the tooth that you and I can see, and that the white part is called the crown, and anything underneath, is known as the root. And the roots really come up, if I was to show you on here, the root of the canine comes up to here. I don't know how well you can see that.
I'm going to remove the slide for a bit so that the viewers can see what you're showing on the
slide. Okay. So you've got your canine tooth here, and the root goes all the way up to here. So there's actually more of the root inside than there is sort of a bit like the tip of the iceberg.
Right.
So if you
like the Titanic.
Yeah, exactly. So if you were to do a cross section of that tooth, if we go back to the image, then it shows the different layers that it's all made up of. So the white bit is the enamel, that what protects it, and then you've got other layers underneath, and the one in the very middle, the pulp cavity, is what gives us pain. So I don't know, Andrea, if you had toothache recently?
Thankfully, no.
No, I know. I had it a little while ago. Oh God, it's one of the most, and I know there's nothing worse than chronic pain.
Yes, I completely agree.
Yeah, the pulp cavity is where your nerve endings and blood vessels are. So their teeth structure is what I'm trying to say is no different to yours. So if you have toothache, you know what it's like. We tend to be down to the dentist as soon as possible. It's no different for them at all.
Right. So this is what we're talking about. This little pink thing right in the middle of the tooth, right? That's the pulp cavity, right?
Yeah, that's it. That's
which causes the
Yeah.
Okay. Cool.
That's what you don't want ever exposed.
Right. Certainly not.
No.
Okay. So here, this seems to be like the structure of the inside of a dog's mouth or something.
Yeah. No, that's
it. You want to explain to us what are we doing? Like what what is the function and how is it different from a human's anatomy?
Yeah, sure. No problem.
Yeah.
So I mean, I know that there's a skull on the thing, and I've got a skull here, but I'm not completely weird. Promise. There's lots of skulls around. Lots of skulls. This diagram really shows, so all of the teeth have got names, the same as ours. The front ones, the blue ones there are what are referred to as incisors. And then you've got your green canine, and then you've got the pink ones are premolars, just meaning they're before the molars. And then the big ones for grinding at the back are the molars.
Okay.
So
these are similar in terms of the names of the teeth. They're similar to humans, right?
Yeah, exactly.
It's just that their placement and the usage is a little bit different as compared to us.
Yes, a little bit. I mean, our canines, we would have fangs like Dracula if we had very long canines. But the canines are still there. But thankfully, we have a knife and fork, and we don't have to rip our prey or tear it.
I'm glad for that.
Yeah. So it's just showing you, how difficult or where those molars are in the very back of the mouth. That it's, if you're cleaning them, it's very hard, area and space to be able to get to.
Okay, cool. And what is the function of each of these, these portions of teeth, sort of? So, what is the most highly used part of the teeth? When it comes to a dog or a cat. which part of their mouth or their teeth do they use the most?
Okay, yeah, that's an interesting question. In relation to what do they use the most, some of it will depend on diet, some of them will depend on lifestyle, but definitely the molars for grinding. You've got the incisors for sort of picking up of food and chewing and nibbling, and for grooming, because we know both cats and dogs do groom. We see them groom. And obviously, you've got your incisors there for sort of, the tearing function. But different skulls, different breeds of dog have different shaped skulls as well.
Okay.
And that can also
see if I can find that thing for you. Oh, this is a different image of a cat. So could you tell us what this image is about, Joe, please?
Yeah, no. So this image is just showing a cat, that's got quite bad. You can see the tartar, the calculus on the back of the teeth, and the gums quite red. Okay. Yeah, exactly. So that's called gingivitis, and it means inflammation of the gum lining. And I'm sure maybe, we've got people watching who've seen that in their pets, and it will be sore, and it will be uncomfortable for them. It's not supposed to be bright red.
Okay. So what would somebody do, as a first aid, for first aid for something like this? Like maybe if their dog or their cat has apparent pain in their gums or something, is there something we can do at home? Maybe give them some ice, or is there something that can be done at home to deal with it till they get to the vet?
Not if it's got to this stage, unfortunately. No. With puppies that teeth, and we might get to that in a little bit, when puppies are teething and when they're chewing, it is possible to maybe put a little bit of Bonjela on their gums to help them, but unfortunately it would be a descale and polish to make this patient feel more comfortable, or have the teeth extracted. So yeah, definitely.
Okay, all right. So this is an age-related thing, or do we see it in young animals as well?
No, again, it depends. So the statistics earlier were, that you've got a large percentage of 85% of dogs and cats over 3, which is very, very big. I think if you were never to brush your teeth for 12 years, don't try it. Don't
have a husband.
Don't try this at home. But it's not, you would expect to have some form of decay or tartar build-up, etc. So this is what's happened. But some smaller breeds can be predisposed, so they can have problems at an earlier age than other breeds. But generally, the older they are, if you're not doing anything with the teeth, they will eventually end up looking like this, unfortunately, yes.
Okay. So when we're talking about breeds that are predisposed to something like this, we're talking about the more flat-faced breeds, or,
Yeah. So the flat-faced breeds are your pugs, your boxers, your French bulldogs. I'm just trying to think. All of those are, because of their skull shape, because they're flattened. So you've got, this is a fox, but, we can pretend it's a dog. We can pretend it's a dog in makeup. So adult dogs have 42 permanent teeth.
Okay.
And it's, they're nicely spaced. You can see here in the canines, nicely spaced around. When you've got less of a skull for your pugs and your short nose breeds, they've lost a lot of room. So they tend to have a problem called overcrowding. So you might have teeth on top of each other coming through. Whereas Labradors, normal sort of shaped dogs, beagles, those
they don't have this issue.
They don't tend to have as much of a problem.
So if a pet owner has a pet like a Shih Tzu or a pug or a boxer, they should check on the teeth more often than an owner that has like a Labrador or a beagle or a dog with a nose, basically.
Yeah, that's it. Yeah, a dog with a nose. But because you think of the size of a Chihuahua, they've still got to get 42 teeth into that mouth.
Right. Oh, so regardless of the size of the head of the dog, there's still going to be 42 teeth. So they could either have enough space to space it out really nicely, or they could just cramp it all into the one small little space.
Excellent. Yeah, absolutely. So it doesn't matter if you're a Chihuahua or a Great Dane, you've still got 42 teeth.
Oh, wow. Okay.
Yeah.
That's interesting. Okay. So I'm going to put back your slide on now.
Okay.
And yeah, so we have the disposition of plaque. So can you just explain that?
Yeah, sure. So when we're brushing our teeth twice a day, at least, aren't we, Andrea?
Yep, we are. Yeah. We're good children here.
Yeah. We're doing sort of obviously the outside of the teeth. So you'll find most of it, and pet owners will find most of it on the outer surface of the tooth, which is known as a buccal surface, rather than the inner tooth. And the thought for that is because you've got the tongue in the bottom jaw always moving. It's a bit of friction to help prevent the plaque build-up. Whereas on the outside, they don't use their tongue. And if pet owners aren't brushing, that's where it'll be. And that's where people will see it on their pets as well. Okay.
All right. So we have a question from, a viewer here. So Pearl is asking, it's Shih Tzus are predisposed to dental issues?
Yeah, hi, Pearl. Thank you for getting in touch. Yes, they can be, certainly. Again, because of the conformation of the head, and small breeds do, unfortunately, tend to suffer more with overcrowding and things like that. But it's all about getting your puppy as a puppy, getting them used to being handled and, felt and manipulated around, and then opening the jaw and making sure you can see. Because especially in the Shih Tzu mouth, when you're opening the jaw, it's very difficult to see the back molars. It's in a lot of them, and especially cats. And if you've got a scratchy cat, I'm not that brave with cats. to see the back molars is always difficult. It's always difficult. But they certainly can be. Yeah, Shih Tzu, small dog, and a bit of the squash face there. Yes.
So we have another question from Nuri Singh Soni, and they're asking: is it suggested to manually brush the dog's teeth?
Yes, absolutely. So thank you very much for that question. We'll get onto it, and it sounds a bit crazy. And 20 years ago, when I started in practice, if you'd have said clean your dog's teeth, you get some very weird looks about why to do it. But prevention's better than cure, and brushing every day is most definitely the way to go. It's always, gold standard. Yes. Are you doing it now? Can I ask Nuri a question or?
Of course. Nuri, can you please answer Joe's question? Are you brushing your dog's teeth yet or not?
Yeah, that was it. Yeah.
So Nuri hasn't answered us yet.
Okay.
In the meantime, we can go to another question. Siva Prakash is saying, one second, I'll just put it on there for you. Is there a way to remove tar and plaque using beer fur-like products?
There are, if it's really bad, if you've got a big, amount of tartar and plaque there, then the only way to remove it is through a descale and polish. There are different products out there. When we come to the prevention and I talk about the product, I think there are some beefer ones out there that are trying to sort of do the same thing as Plaque Off, but in a slightly different way, or not as good. But it depends on so much on owner compliance, how compliant your pet is with you. But, the brushing is the first, but we will get to that a little bit later, certainly. Cool. Thank you.
So in the meantime, we shall continue with our presentation that Joe has so nicely made for us. So we're done with the plaque, or we're still talking about this? We're done.
Yeah, that's it.
Okay, so let's move on.
Thank you.
All right. And what is this? Ooh, it looks scary.
It's not a skull.
Thank God for that.
It's good. So this was taken. So the picture on the left, my left, I think it's yours as well. So the first image, I should say, is a before photo, and the other one is an after a descale and polish. So it's an older pet. You can see, there's quite a lot of discoloration on the teeth and some tartar. When dentals are performed, the plastic tube you can see, that's it. That goes down the trachea, and then there's a little cotton swab at the very back, like a yellow one. That's it. Yeah, and then there's lots of water and spray from the dental equipment going down the throat. So they've got a before picture and an after picture. And you can just, it just looks a lot nicer, a lot healthier. And then your next slide, hopefully, is the best one. I hope.
Oh, there.
So this is Lush. I love this picture. This is a real old timer. So he's been in, he's an old man, and he's had his dental. He's been on intravenous fluids, and as soon as he's sort of able to and woken up, he's eating. You know, it's incredible. And some of the time, even if they have most of the teeth extracted, they feel so much better, because we've already said how we wouldn't put up with toothache for very long. And if your dog's 8 or 9, then it could have, you know, it's got chronic pain and being uncomfortable and discomfort from maybe the age of 5. So for 4 years, it's just been grumbling on. And they are remarkable when they come around from dentals. And this is a lovely, lovely picture. Thank you. I like this one. I like that.
Cool. So, so what I wanted to ask you, Joe, was, you know, how can you tell that your dog or your cat is having trouble with their teeth? You know, sometimes, you know, if you look at the teeth, you can't really appreciate, because you are a trained eye, right?
Yeah.
So you've been doing this day in and day out, and you would be able to identify a dental problem way earlier than a pet owner would.
Yeah.
So if at all a pet owner were to identify a dental problem, how would they do it?
Okay. Well, I would say there are different things that owners might notice depending on whether they're cats or dogs. But it could be that maybe they're seeing a little bit of blood in the water when they're drinking. It might be that they're favouring one side of the mouth. So when they're eating, they're you know, it's very obvious that they're chewing on the one side. You might find that they're not playing with toys quite as much as they wanted to, because it's painful for the mouth, especially to play ragga or anything like that.
Yeah. Okay.
Yeah, all of those types of things. I think the main thing is like halitosis, the smelly breath. That's what most people will obviously notice, is the smelly breath.
So if a dog has a smelly breath, that means there's something going on and they need to check it out, right?
Yeah, and I think just, you know, just by normally lifting up the gum and then having a look at the canines. Storm, come here. I'm just going to see if I can get my dog to demonstrate. Come here.
Awesome. We love that. Don't we love that, guys?
Yeah, I don't know that he's quite so keen. Right. Okay. Apologies.
Hello, Storm.
Hello, Storm. Okay. His other name is Div, for obviously
hello,
reasons.
Div.
Yeah, for obvious reasons. So you might, you know, think, oh, he's a bit smelly, or, you know, they start dribbling a lot as well. They might salivate and dribble quite a lot. And so if you lift up the lip, and then you can have a look at the tooth, and if there was lots of staining there, and then, like you say, we're a bit used to it, and he's used to being manhandled, and he's got really good teeth. He's got a little bit of staining on the front canine, but it would normally be, you know, it would normally be that you don't want to kiss them and those types of things. But, you know, he's a good boy. Mwah. So he's a good lad.
Okay. So the minute we find stinky breath, we should start thinking about getting our dog's teeth clean, maybe by brushing at home or using products that would help clean the teeth, right?
Absolutely. Absolutely. And prevention's better than cure. So the sooner you start it and get them used to doing different things, the better. Yeah, absolutely.
So do you recommend that everybody starts brushing their dog's teeth? You know, by what age would you recommend it?
I would say, you know, get them used to it when they're puppies. Even as soon as they have their, you know, the teeth sort of through, you know, 12 weeks, 3 months. It doesn't matter that those teeth are going to fall out, because it's all about getting them being used to being handled, restrained, use of a finger brush or a toothbrush. It needs to be sort of part of their routine when they're very young, ideally. Right. So you can start as soon as you get them.
Okay. So I have seen many pet parents, you know, when the puppy is new and they brought the puppy home, they are really enthusiastic about doing everything, you know. Yeah. They'll want to brush the dog, and they want to play with it, and they want to train it, and they want to brush the teeth and do everything. But, you know, maybe 6 months, maybe a year down the line, the novelty of it wears off, right? Yes, so if you stop brushing your dog's teeth, is you know, what do you do then? Like is it something that you must do throughout their lives? Is it okay if you do it just once or twice a week, or should you you know, like make sure that you're making it a habit even for yourself to do it every single day?
Yeah, it should be every single day is more beneficial. If you're doing it once or twice a week, or willy-nilly, it's really not worth doing. So it's about getting them used to and comfortable. It's not always possible if you've got a rescue dog that's very head shy, or even if you own a cat. You know, cats. Right. Yeah, cats. Are
I do own one.
Just
yeah, and I will not put my finger in her mouth.
Yeah, no. But ideally, prevention's better than cure. So we will talk about different methods of prevention, but your creme de creme, you know, the best way, tip top, is to brush every day. And ask me if I brush his teeth every day.
Do you brush his teeth every day, Joe?
No.
Well, because you have something even better that you're holding off till the end. So we'll hear about that later. We're really excited to hear about it. So cool.
That's fine.
We have a question. Okay, the question is from Siva Prakash. What else do you suggest for dogs to clean its tooth? Bones. I tried Kong toys, but it doesn't use the toy regularly.
Okay. Kong toys are brilliant. They're very good. They're, you know, nice, and providing you get like the right one, they're quite durable. They're not often designed to sort of clean. Bones the problem with bones is they can splinter. And if they're not, so I would say a lamb bone, definitely not lamb bones. And I think, you know, I might occasionally go to the butcher and get a beef knuckle bone, which I know obviously isn't available to you. But I think that generally some of the other things, there are better things than bones. And especially if they splinter, they can cause an obstruction or, you know, perforate the bowel and things like that. So, you know, the Kong toys are okay, but, you know, it's all about it sort of, if you can, sort of being abrasive, like with the brush. And if the dogs, you know, don't really chew the toys, then that won't work.
Right. So, I mean, finding the right toy is important, basically.
Yeah, I think finding the right product that both you and your dog will use, or your cat. Yeah, definitely.
Right.
Definitely.
Right. So, so all of these, you know, things like a lot of companies have products like dentist sticks and, you know, different kinds of dental sticks, or you have these little toys that have these, you know, pokey things, these rubber pokey things all over, and they claim to clean the dog's teeth. Do they really work, or is that?
I think it does
subjective?
depend on. It does depend on the product. There is something called the VOHC, which stands for the Veterinary Oral Health Council. So you could go onto the VOHC website, and there are studies that are done. So it's proven, if you want, there's evidence, which is what you said. Does it work? Does it not? The VOHC, so the products listed on their website will say, yes, it honestly does work, because there are a lot of things out there that don't. And sometimes if our pets are older, they're overweight. They might be overweight in the UK, they can be. And you're giving them different treats and bones, and you think it's for the dentals, but they're high in calories, and then that adds on extra weight.
Right.
You know, that can then cause problems with arthritis, and it goes on and on. But so the Veterinary Oral Health Council website would be the one to look at. And then anything that's sort of proven to work will be listed on there.
Okay, cool. And Joe, when we were talking earlier, you were speaking about other health-related issues that happen due to bad oral hygiene, you know, which is not necessarily only restricted to the mouth, right? If there's bad oral hygiene, you were saying that it affects the inner parts of the body as well. Could you talk to us about that a little bit?
Yeah, sure. I'm not sure if there might be a slide a bit later, but that's fine. That's okay. So if you think about, I don't think with bacteremia it was, but that's fine. Don't worry.
I think so. I'm going to put on the slide. We have something. Oh, this is about how Plaque Off. Oops. I almost gave it away.
That's fine. So when we looked at some pictures with the very red gums, they can bleed because the gums are sensitive. And the same way that if you go to the dentist, they say that if you see signs of bleeding, that's a bad sign. You should go and see your dentist. So the gums are going to be very sore. There's hundreds and hundreds of different types of bacteria in the mouth, which is why if you're bitten by a dog and a cat, you need to wash it very, very quickly. So it's literally an injection of bacteria. So if you think of a really bad mouth that's bleeding, you've got the gums here that are bleeding, all the bacteria from that mouth will go into the bloodstream, and that blood goes all around the pet's body like it does our body, and it will go around the heart, the liver, the kidneys. So if you have a pet that has a cardiac problem or liver or kidney damage, then it can exacerbate and it can make it worse. I need to say that there are some people that believe that that's very true. There's no clinical evidence yet, but there are a lot of people that think, that this is, it does affect our geriatric patients, definitely. And I'll just say, sorry, I was just in a college last year, and a student nurse said that her brother's got a very bad heart condition, and her cardiologist said for her brother that he should be brushing his teeth 4 times a day.
Oh, wow. You're talking about humans.
I know, exactly. So if, it's completely possible our pets have heart problems. So, and if we're not cleaning them at all, and they're telling this young lad to clean 4 times a day, he doesn't.
Oh, there is some connection there. Yep.
Yeah, absolutely.
So we have this question coming from Mr. A.K. Mittal. So pretty much what we're talking about. It says, what are the major diseases which originate from not maintaining oral hygiene? And what are the first symptoms for those diseases?
Yeah, there's lots of different ones you can get. So the periodontal disease, if it's left and progressive, then, eventually tooth loss will occur. But before then, you can obviously get lots of pain. In relation to diseases, you can get, abscesses that will occur. It's more about discomfort. But cats can get Kalichi and they can get very bad ulcers in their mouths. I'm just trying to think if there was an image. Cats can get
the ulcers image. Let me see if I can find
different phorals, etc. But the first symptoms would be either, if you've got a lot of tartar, smelly breath, maybe a hesitancy to eat food, stop chewing, stop playing, stop mouthing. But definitely, tooth loss and extractions, we can take, I remember once a small dog coming in and we removed every single tooth, But,
oh my God. So how do they eat then after that? So it's like they cannot eat anything solid. So everything is mashed up for them.
No, on dried food, perfectly fine. Perfectly fine. Because if you look, is your dog on dried or wet food?
Mine is on a mix of both. So
both. Okay. So if you look, sometimes if they're eating the kibble, they don't chew every single piece, or if you throw them something, quite often they just swallow it. They don't actually chew it. So cats and dogs will just pick it up and swallow. Pick it up and swallow. But you don't have to put them on soft food. They just pick it up. And quite often their tongues will stick out, bless them, because they've got no incisors to keep it behind the...
Oh, honestly, I find that really cute.
Yeah, I know.
I'm like, oh.
But the thing is, the tongue can dry out quite quickly. But
yes, that is true. I've seen that a lot in pugs, actually.
Oh yes, definitely. And it will be the pet will be much happier having no teeth than having a mouthful of very painful teeth.
Right. Okay. We have another question here. Will the gums tell us the overall health of the dog? If we press the gums, how to find normally anemic? Also, will kibble help reduce tartar? Is it real or a myth?
Okay. All right. That's very good. There's a lot to deal with there. So the overall health is, you're absolutely right. So it should be a nice pale pink colour. I think he's gone, so I can't go and grab him again. He's gone.
Okay. Mine is sleeping like...
Yeah. Nice pale pink. If the gum margin is inflamed around the tooth and red, like we saw in some of the earlier pictures, then
do you want me to put up one of the... I've got one of the first one that we were talking about.
Yeah, they aren't too...
Is that too much?
Is there...
So that's like a...
So that's showing all the tartar, definitely. That is showing all the tartar. But you're right. If it's all very red around the tooth margin, the gum margin, then that's definitely a sign.
So maybe should I just pull up the cat one for you? I'll just pull that up and...
Oh, okay. Yeah, lovely. Thank you.
Yeah. Just give me a second. So in the meantime, there's someone else talking in the background.
Sorry.
Okay, so let me see. Okay, so yeah, maybe this one works.
Brilliant. Yeah, that's brilliant.
Okay.
So you can see that the gum margin's a little bit red. Excellent. Yeah, thank you very much.
Yeah.
So because that's red, that's obviously causing quite a lot of pain and discomfort. So you can have a mouth that's, you know, got a lot of tartar or anything else like that on it. But if the gums aren't red, then it's not as painful. But definitely, if you've got a patient that's got gingivitis, that's going to be sore. The question about being anemic, so it should be a nice pale pink colour. If they do go, you know, there should be a nice a salmon pink colour. If they're pale, that can mean that they're anemic. It could also mean that they've got circulatory problems. You know, there's lots of different reasons for that happening.
Okay, cool.
And the kibble, yes, it will help them rather. So dried food is preferable if you think about the sort of the action of chewing as opposed to picking up soft food and just swallowing. So it does help, but for it to be, you know, completely A1, then you would need to have a prescription dental diet. But as a basic dried versus wet, dried is better. Yes.
Okay, cool. So I think that answers your question, Sivaprakash, I hope. Okay, so let me check if there are any more questions right now. No. Oh, so Mr. Mittal loves the sweet talking in the background. I think that was Div. He's talking in the background.
Terrier for you, as you know, terriers.
Yes, I do know.
Exactly. Yeah. Oh,
all right. So if anybody has any more questions, guys, could you, you know, just type it up. In the meantime, we're going to move ahead with prevention is better than cure. And Joe's going to tell us how would you prevent. I mean, we've talked about brushing our teeth now. Not our teeth. I mean, ours and our dogs' teeth and our cats. But it's not always easy. So there are other options in the market that can help you. It's not, you don't always have the time or you don't always have the resources to do it, you know. No. And also, Joe, can you please clarify to our pet parents about whether or not they could use human toothpaste for their dogs?
Okay, yeah, no, that's fine. And like you started off saying, you see pets that are groomed and everybody's really keen to do it. And I was really keen to clean Div's teeth, and it was every night before bedtime. You know, we'd have a little routine, and we'd do it, and then life got in the way. It's as simple as that. Yeah. It's not, you know, I know I should be doing it, but life gets in the way. So you're right. You shouldn't use human toothpaste, and that's because of the amount of fluoride that's in it. And you and I brush and spit it out, whereas our dogs and cats would swallow it. So that's why.
So using human toothpaste is a big fat no-no.
Yeah, that's it. Yeah.
Okay. So if they don't have toothpaste, what do they do?
Okay, if you don't have toothpaste, there are dental diets that are out there that need to be fed, you know, specifically as that. And you can maybe sort of try and use some bones. There are different things that you can add to the water, but a lot of them, you know, brushing is always the best. And if you can't do that, then there is obviously the reason that, you know, Storm's teeth look really good is because I use something called Plaque Off that goes on the food.
Cool. So there are two people that are asking the same question.
Oh, okay.
There's Swapna Tripathi. She's saying, would calcium bones help preventing cavities? And even Richa is asking the same questions. She's saying doctors suggest calcium bones. Are they really good?
Okay. So, it's not something that I'm familiar with over here, calcium bones, because you would need to be careful that you're not giving them too much extra calcium, because that can cause problems anyway. But I would say cats and dogs don't have caries and cavities like we do generally. So because they're not fed a sort of high sugary diet, they don't tend to have cavities. Not a filling as you and I know it. It's more because of the plaque and tartar build up. It will cause, you know, pain within the gums, and it can obviously lead to the foul smelling breath. And if the disease is allowed to progress, you'll lose the tooth root and then, you know, eventually lose the tooth. But calcium bones I've not heard of. And I would say, you know, like I say, dogs and cats generally, they don't get cavities like we do.
Okay, so calcium is really, it doesn't really make too much of a difference
No.
apart from an overkill.
No, that's it. Yeah. If they're on a good quality diet, which I'm sure they are, they don't need extra calcium in their diet.
Okay, awesome. Okay, so Cherian is here. Hi, Cherian, how are you? So Cherian is asking if is there an efficient way of preventing tartar for a dog on premium kibble food?
Yeah. So what happens is that you have plaque. Plaque starts off. So we all brushed our teeth this morning. We've had lunch or dinner, and then you can run your tongue over your teeth, and it might feel a little bit furry. A little bit furry.
Just a teeny tiny bit.
Yeah, just a teeny tiny bit. Yeah. So that is already the startup of plaque, which is known as a biofilm. So plaque will feed on bacteria. It will feed on food, and whilst it's there, it grows and it multiplies. So you'll have plaque based, and then when it's left and it hardens, it then becomes tartar when it calcifies, and then that's very hard to move. And because it's a rough surface, it then attracts more plaque to stick to it. So the premium kibble food, because they're crunching, should help. But if it's not a specific dental diet, quite often the biscuits, the pieces of kibble break very easily. So if they're not swallowing them whole, like Div does, he just sort of inhales, picks it up out of the bowl and inhales.
The vacuum cleaner.
Yeah. And any Labrador owners out there know that what inhales mean. They just up straight away. They're not actually chewing it anyway. But, dried food, versus wet will, because of the mechanical action, have a little bit of more of a response. Yes.
Okay, cool. So we have a question, another one from Ruhi Kulkarni. She's asking, what are the uses of different dog toothbrushes? The ones that look like human toothbrushes and the ones that you put on your finger.
Yeah.
Do you have any preferences or recommendations? So I think you have like another type that has like this little V-shaped thing, It's sort of is supposed to cup the teeth and brush it like inside and out. Maybe I should use one of those.
When they're young, definitely the finger brush. The finger brush is definitely the one to use and to start with. It gets them used to, just being handled and having the finger brush in there. You can actually use, so a lot of the pet ones are longer to allow you access to the back of the molars, because it's a long way back under the gums. But you can just use a pediatric or a child's toothbrush. That's absolutely fine. So a child's toothbrush, but definitely a pet-friendly toothpaste. Okay.
And I have a question here. Like now, for example, if we have a Shih Tzu puppy or a Chihuahua puppy, right? And, obviously the finger toothbrush goes on the finger. But can the finger fit in the mouth? What do you do when that cannot happen? Because the mouth is like really tiny and your finger is kind of big as compared to that tiny little head, and you're like trying to scrub it in there, and they're like, oh my God, Mom, you're killing me. So, what do you do then?
I know. What we can do, I don't know if you have it out there, but in the UK, you can have a little bit of elastoplast plaster. So a plaster that you put on a wound. So it's sticky, but it's got knobbly edges. So it comes on a strip, and you just chop it off, and you put that around your little finger, and you can use that. Most of the time when they're young, it's about getting them used to being restrained, because they don't like it. And obviously it all needs to be a really positive experience for them. It needs to be lots of praise. And when you're starting off, just literally, seconds, and then letting them go, lots of praise and building it up.
Right. So don't try to brush their teeth whole the very first time you pin them down.
Yeah, no.
Pin them gradual thing. You're like, brush your teeth now.
And then we wonder why
slow
they
and
run
steady
off.
is what we're looking for.
Just slow and steady and building them up, lots of praise and positive reinforcement.
Right. Okay, cool. Okay, so we have a question. We've already answered this, but if you could just answer this for Richa. Richa says, would you recommend dental surgery for tartar removal? I have often seen doctors recommending that.
Yeah.
So why would that be, and what is your opinion?
Yeah, no, definitely. If the tartar is very hard and there's a lot on there, the only way to get rid of it when it's gone that far is a descale and polish.
Okay. All right.
Which is why prevention, stopping it from getting there is obviously better.
Okay. Awesome. Okay, so we have another question from Cherian. He says, would you think that there is a connection of plaque with hardness of the water?
Oh, that's a good one. In all honesty, I don't know, but I don't think so. I mean, I'm in a hard water area. A lot of the pets that we see in clinic in the UK will be in different mixed areas. And it's just, plaque exists on our teeth. Feel it now. And if you don't do anything, we will have a problem. But don't try 8 years at home not brushing your teeth.
Cool. Also, we have a very time relevant question.
Yeah.
Sudais Khan is asking, can corona spread from cats or dogs teeth cleaning? The coronavirus we're talking about.
Yeah, I have no idea. I'm not a virologist. I would say at the moment, I don't think that there's any real evidence. We're not worried about cats and dogs sharing it here. No, I mean, when you're doing a dental, all the vets and nurses wear masks and gloves because of all the bacteria in the mouth. And when you're using an ultrasonic cleaner, there's quite a lot of spray from the water. So there are bugs and nasty things, and you wouldn't want to have your cup of coffee on the side while you're doing a dental.
Right, but I'm sorry to cut you off.
That's right.
What he probably means is when you're doing everyday brushing, I mean, you're obviously not doing your mask and your gloves and things like that. So do you think there would be a risk of infection or anything like that? What is your opinion on the subject, considering we're like in pandemic times?
Yeah, I would say no.
No, right? Okay. I mean, I would think, Mr. Khan, I would think just, be a little cautious and wash your hands. And if you can, probably wear rubber gloves or something, just to be extra safe, right? Do you think that would be a good idea?
Yeah, definitely.
Cool. Do we have any more questions right now? Okay, I think we don't have any more questions now. So we can probably move on to the prevention is better than cure. We've already gone through that entire thing, and we can now probably talk about what Jo represents and what she has been representing for the past few years. And that's our little secret surprise for you guys. Something that's going to help you and your pets without all the headache of actually trying to brush your dog's teeth every day. This is a much easier and a great way to keep your dog's teeth clean. So I'm going to put the slide on now, which I had put on earlier, but I removed it quickly. So there we go, and it's all yours. So.
Yeah, that's all right. Thank you very much. So the product is called Plaque Off. It is on the VOHC website that I spoke about earlier. So the veterinary oral health, it's on there, and it says that it works, and it does exactly what it says on the tin. So whereas we are used to brushing like a mechanical action to remove tartar, this product works systemically, so through the body. So it's a dried seaweed, comes from from Norway. It's now sustainably harvested, and it's a specific type of seaweed. So it's not something that you just go down to the beach and get, on the south coast or something like that. You put it onto your pet's food. It comes with a little scoop, and the scoop's probably about the size of my fingernail. And depending on how much your dog weighs will determine how much your pet has on its food. So they eat it. It goes in, it's digested. Nobody actually really knows sort of exactly the mechanics of how it works. But after it's ingested, enzymes are released through the dog's saliva or the cat's saliva, and it prevents plaque from sticking to the teeth. So it's a prevention thing. So if you haven't got plaque that's able to stick to the tooth surface, that won't then harden and calcify and turn into into your tartar or calculus, whichever you prefer to say for your pet. So it's, improves, obviously, there's a lot of bacteria in the mouth, so it'll also improve sort of the halitosis, the breath smelling and things like that as well. And results are seen within sort of 2 to 4 weeks. It does depend how advanced the dental disease is. If it's really, really bad, then it's not going to remove it. It might soften it, and by softening it, you might be able to use your fingernail to scratch it off. But I think it's because it works internally. They're like, what, you don't chew it? You don't, no, it just goes on their dried or their wet food. Div has it on his dry food. Occasionally I'll give it to him with a teaspoon of yogurt, and it's to be given every day, and that's it.
Cool. So the kind of cases that you showed us earlier in the slides, the really, really bad cases, would it work on something like that, or is that something that only a vet can help you with? And this is for a milder.
Okay. If it's progressed to some of those images, then unfortunately it is too late, which is why we can sort of say that prevention is better than cure. So you can start to add this as soon as they've got their permanent teeth to the animal's diet. And if it's mild, then hopefully it will soften it, and then you'll be able to, break it off with your fingernail. But it's about stopping the disease from progressing. So even if they have got, tartar and staining there, if you can add it to the food now, then it stops that dental disease getting any worse. It might not, it's not going to go away, but it stops it from getting worse, which is probably the most important, because if you do nothing, it will get progressively worse.
Right. But so in milder cases, do you think that does it help remove any tartar? Or
absolutely
it does?
Yeah, it does. Yeah, it helps soften it, and then you can crack it. And if nothing else, it really helps with the breath. With the amount of bacteria, it reduces that, and it does help with the smelly breath syndrome.
And it doesn't affect the dog any other way in terms of health or anything like that, because they're ingesting the seaweed and it's helping break up bacteria and things like that. It doesn't help them, hurt them internally.
Okay, yeah. The only issue would be if the patient had an overactive thyroid, which can be common in cats, and you wouldn't use it in cats because of the iodine release. But otherwise, because it's completely natural, it is just seaweed. It doesn't cause diarrhea. It doesn't matter if the dog's got allergies. It's or the cat. It's exactly the same product for cats and for dogs. And at first, actually, it came out on the human market. So there is a human version of this.
Oh, yay. Yeah. I don't need to brush my teeth now.
Exactly. So there is a human version that comes in capsules, but the product inside the human capsules is exactly the same. So I've been at different shows like Crufts, etc., and they've said, people have come up to me and said that they put it in their smoothies in the morning for breakfast.
Oh wow.
Yeah, because it's just seaweed. They put it in their smoothies. Somebody mixes it in with a salad dressing, so there you go.
Okay, so it's safe for us. It's more or less safe for our pets as well. And then, of course, it is better to have a word with your vet before you start any kind of supplement for your dog or your cat, right?
Yeah.
Okay, cool. So we have another slide. That's the last slide. Yeah, that's the last slide. So do we have any more questions, guys? Let me just get this off now. Would you like me to just keep that on so people can just, have a look at it?
Absolutely. Thank you. Yeah.
Okay, so Sharon is asking, how long does it take to make an impact? Is it available in India through Bharat International? Is it available through Bharat International? I don't know. Is that your supplier here?
Yeah. So in relation to sort of wholesaler, I can get back to you with some more details on that. I know it is over there, and the lady that we were talking with the other day, Pearl, is distributing. But I'd need to double check on that. But it does, to make an impact, it depends on what you're using it for. If it's for smelly breath, then it will be, relatively quickly. If it's, you've got to think, if you've got 8 years of progressive disease, it's not a miracle. It's not going to happen overnight, but it will definitely stop it from getting worse. And it is, like I say, on the VOHC, the Veterinary Oral Health Council list, as, it's got evidence there to prove that it does work.
Okay. So guys, anybody who's watching, DogSpot, it's available on DogSpot in case you guys are interested in trying it out. I would recommend having a word with your vet and making sure that your dog or your cat does not have thyroid or anything like that, since Joe said it might be an issue. So always do your checks, always check with your vet and do your homework before using any kind of product. I mean, the product is amazing. I've heard good things about it, and I am going to try it out now, Joe. So, maybe for myself as well. Yeah. I will brush my teeth as well, though. Yeah. I'll try.
Excellent.
So Sharon is saying he's been using it for a few years.
Oh, okay.
So, yeah.
Is that yourself or animals?
Sharon, do you have an answer to that one?
It could be.
Cool.
But that's good.
Well,
Thank you very much.
yeah.
Good feedback.
I think that's just putting the slide back there for people to see what Plaque Off is all about. And yeah, so do we have any more questions, people? I think people are quite satisfied with with their questions and with the way you have answered them. So thank you so much, Joe. That was really, really cool.
No
And
problem.
I have learned so much because I'm gonna really concentrate more. Oh, Cherian said it's only his dogs. So
Okay.
yeah, that's the answer for you.
Put it on your breakfast in the morning and see.
Yeah, try, Cherian. Come on.
Yeah. Give it a good couple of weeks and you will notice a difference.
Yeah, and suddenly he will like shining, like smiling really bright.
Very much.
So cool. So this has been great, Joe, and thank you so much for taking the time and explaining this to us so well. And because even I have understood the importance of dental oral hygiene in pets, and that is something that is actually ignored by a lot of Oh, Cherian says he didn't know he could use it. Well, you can now, Cherian.
Yeah.
Now you know.
No excuse now.
So yeah, so I mean, I have understood the importance of dental hygiene, and it's not just it's not limited only to the mouth, and the rest of the internal anatomy also gets affected by it, as it does with humans as well.
Yeah.
So I hope all of our viewers are gonna be a little bit better at the dental hygiene with their pets. And if you guys want to buy it, it's available on DocSpot and it's available at Orange Pet. I don't know, Pearl, is there any number or something you would like to share? Or I think DocSpot is a good place for you guys to try it out. And Jo has been working with it for a while. She knows her stuff. She's been a dental nurse. I mean, not a dental nurse, a veterinary nurse for a really, really long time. And she knows her stuff. So thank you so much, Jo, for sharing all of that amazing information.
Not thank you.
And thank you to Divs, and thank you to DocSpot and all of you guys, the audience. Thanks for the wonderful questions. And we hope you guys are going to take better care of your dog's teeth and your own. So good luck. And so Pearl has given us Orange Pet's number. So if any of you would like to take down that number, I put it on the screen for you guys. I'm going to keep it on there for another minute or two, and then we'll just take it off. And in the meantime, is there anything else you would like to add, Joe? Anything you could think of?
No, I think it's about education, and I think people don't often think of the dogs and the cats as being the same as us, but the structure is exactly the same, and some of the problems are because of the breeds, conformation of the skulls that we talked about earlier. So some of the it can't be helped if you're having that breed. It might be something that comes along with it. But it is, we want to love them, we want to hold them. And I think when they get a bit older, people expect them to smell and they, put a bit of distance, but it doesn't have to be like that. So by able to, use something like Plaque Off and make sure that it doesn't progress, it's a no-brainer because it works. And it's so simple, so simple.
Cool. So in conclusion, we get Plaque Off, we get clean teeth, we get clean your dog's teeth, healthy dog, kiss your dog, hug your dog, even if it's old. Yeah. I mean, the older the better, because the oldies really need some extra love, and
absolutely.
And some of them get a little bit cranky, but most of them need that love. So Plaque Off will help you, not punish yourself while you're trying to hug your dog.
Yeah.
So thank you guys, and thank you so much, Joe. And we're gonna say bye-bye now. And this is a great session. And thanks to DocSpot for having us all here.
Yeah, thank you.
See you then. Bye-bye.
Okay, bye. Thank you.
And there we go.